I wanted to thank you very much for coming tonight. You know, this is the beginning of the holiday season, and a lot of times people have great expectations of what will happen during the holidays, but a lot of people are struggling with depression at this time also. So I think what would be helpful is taking a look at what goes into developing depression and what people can recognize in others and encourage them to get help if that's warranted. So let's take a look. I'm going to tell you that I'm new to this slide changer, but let's take a look at depression. The first thing to be very aware of is that depression is very treatable, that people recover from depression all the time, that if you get treated for depression, you may find that you're less vulnerable to some medical illnesses, and that if you also get treated for depression, your interest in yourself and caring for yourself improves. And the reason that we want to make sure that people get treated for depression is because for some people, if it's left untreated, it may be fatal. I think most people are aware that people who suicide may have had an untreated depression, and that's something that we want to avoid as much as possible. Losing loved ones or people that we work with or other people that we care about, that is so important to help others get the treatment that they may need. So is depression very common? It is. You know, about 20% of the population will experience an episode of depression in their lifetime. About 15 million Americans struggle with depression. You know, depression does occur in a wide range, and I'm going to go over that a little bit later, but it is a leading cause of disability in the United States. You know, there are lots of work hours that are lost, lots of relationships that can come to an end as a result of depression, either because people don't understand what someone is struggling with, or they may see it as more of a physical illness and not a disturbance of emotions, or not know exactly what someone is struggling with. And who gets depressed? Just about anybody. That depression does not discriminate. That men, women, children, teenagers, anyone can get depressed. And it's independent of how well educated someone may be. I'm sure that you've seen in all kinds of media that there are a number of famous people who have been clear that they've gotten depressed and have gotten treatment for that, or have tried to struggle for a number of years and not recover from depression. So about 5 to 8% of adults may have an episode of depression each year. And I noticed that we have a number of women in the audience, and we're more vulnerable to the development of depression. Not quite sure why that is, but it looks like women may become more depressed, men may become more involved in alcohol or drug use, and it's not clear if they're using that to treat depression. But women are more likely to develop a major depressive episode, and we're the ones that usually seek the health care, so either for ourselves or for our family. So again, I want to highlight this so that we're aware, and you can notice it either for yourself or for your friends, and again, seek help. And there are several peaks throughout the course of life where one may be more likely to develop depression compared to other times. You know, here it is, you know, we hear about midlife crisis, but actually the years of 45 to 50, people are less likely to become depressed. But in the years of 25 to 44, you know, those years when you're trying to make a career for yourself, maybe getting involved in a marriage, beginning to have children, if those are not going as smoothly as you had wished, that you may be more susceptible during those time periods. And then a little bit later in life, that if those plans that you had when you were younger didn't quite meet expectations, there may be a divorce, there may be loss or death in the family, people may begin to lose their parents or their siblings, their job may not have held the kinds of promise that people had expected, or you may change or move, that those periods of time you may be more vulnerable to developing a major depressive episode. And also, if there's a family history of depression, you may be 1.5 to 3 times more likely to develop a major depressive episode. There is a possible upside of having a family history of depression, and that is what some of the research has found, is that if there's someone in your family who's been depressed, but they've been treated well with an antidepressant and have had a positive response, that may give your doctor or your friend's doctor the insight as to what kinds of medications you may be more likely to respond to. So that may decrease the time that you're struggling with depression if the most effective treatment can be found early on. And again, who gets depressed? Just about everybody. That it doesn't matter how much money you have. It doesn't matter what your cultural background is or your marital status. That if the vulnerability is there and the circumstances are there, that you may be more likely to get depressed. It is felt that there are some types of depression where people may have a biological predisposition. You know, again, if there is a family member, it's not unusual to find particular types of depression that runs in families. So knowing what your background is, you know, that can really be protective and proactive, that you can be more aware and catch those signs early on, rather than waiting for a longer period of time when it may take longer to get effective treatment and to rebound from that depression. Also, again, you know, there may be some genetics involved, that there are families who may be more susceptible. And it is likely that when someone has their defenses, you know, maybe it's their work or their relationships, when those defenses get overwhelmed, you can be much more susceptible to developing depression. Also, you know, certainly situational changes, like I'm certain that when some of the dust settles on the tragedies in New Jersey as a result of Hurricane Sandy, or, you know, Staten Island, or some of these communities where people have lost everything, you can expect that there may be an uptick in depression. Certainly there are a lot of people who just kind of slug it out, but I think you can expect that this can really mobilize people into feeling very overwhelmed. They've lost everything. What kind of supports will there be available to them? Also, when people have a physical illness, and I'll, run down a list in a little bit, but, that can be a loss. If there's some incapacity that you're not able to do the kinds of things that you were once very used to doing, even just aging, that you can't cook like you used to. You may not be able to clean the house like you used to. You may not be able to entertain. You may not be able to be as social. You may not be able to drive where you want to go and do what you want to do. That can really contribute to people feeling depressed. What I had mentioned is that depression can occur along a spectrum, that it's not just one thing, it is not just one entity, that people can have depression and depressive symptoms occur along a spectrum. And I think in psychiatry, the professionals who work with people who are struggling with emotional issues, we've really found that there are some people who may need brief treatment and recover very easily, but there may be other people where you may need more supports, different interventions, and that their symptoms may last over a longer period of time. So what we want to make sure is that we correctly see how serious the issues are and what interventions can be most helpful. But as I noted here, depression can occur along a spectrum from very mild to very severe. And it is a disturbance of emotion. This is not a moral issue. In psychiatry, we do see it as a disease, that there can be biological reasons why someone is depressed. Certainly there can be all kinds of circumstances that lead to this. And I wanted to highlight some of the different types of depression that we're aware of. That this dysthymia that I placed here, this can be seen as a mild form of depression, but it can be very long-lasting. For some people, this can be intertwined with their personality if it lasts long enough. One of the examples that people have mentioned before as an example of dysthymia is, if you're familiar with the Winnie the Pooh A.A. Milne, the Eeyore is seen as an example of someone who's dysthymic, that it just never is quite right, and it's been long lasting, and that's the way he is, and that may not bother him. It may bother other people around him, but it may not bother him so much. But a major depression, that's what you may see more, I think, when people look it up on the internet or you Google depression, that you'll see major depression. That is a clinical term. And what's involved with major depression, and I'll review this again, is people are experiencing some of these symptoms that last more than 2 weeks, where they have crying spells, that their energy level has changed, that their outlook on the future has changed. They may have a change in their appetite. They may not be able to sleep well at night. It is not something that is so transient. This is something that may have lasted for at least 2 weeks. I also noted up here melancholia, and I don't think that this term is used so much anymore, but it had been used 20, 30 years ago to describe a very serious type of depression. You know, melancholia comes from the word, you know, melanin, or black or dark. And I think that's a very apt description of a very black mood, where you see no brightness, no light, that there is very little change in your emotions, that it is all dark. It's kind of like a tunnel, that there is nothing that will sway you. I think most people have seen this as a depression that is more common, or had been described more frequently in older adults, that this blackness that is not dissuaded by anything, that you don't feel the happiness with your grandchildren, or with your job, or with things that you used to like to eat. All these things have gone away. And in fact, with melancholia, actually sometimes people's reality testing goes away, that they keep going over and over and over some slight that may have happened in their life, and they just can't let go. And they think that people may be against them, that family members want to hurt them, or take away their house or their income. So this is a very severe form of depression and can lead to significant social disruption. Also, you may be familiar with a deeper form of baby blues, that some women, after they have their child or their children, or after each child, may experience a significant depression. It's not just the baby blues, because it can last longer. Again, it's not just a transient issue, but I think it's something to be aware of, because, you know, as I look in the audience, I think a number of people here may have children of their own, or grandchildren, that you need to be aware that after childbirth, some women do get very depressed, and again, you know, it's treatable. So be aware of that. Another form of depression is one that is very frequently seen in people who have bipolar disorder. Bipolar disorder used to be called manic depressive illness. And in manic depressive illness, there are a number of different forms. There can be significant cyclical changes, where someone may be very depressed, and then in another phase have lots of energy, want to do all kinds of social things, be lavishly spending lots of money, going here, traveling frequently, and then have a very severe depression following that. And a lot of professionals think that there's a difference in treatment for that type of depression compared to just a major depression, which can also be called a unipolar depression. So I just want to outline that there are these different forms, and so, you know, if you look them up, these are some of the kinds of things that you're going to see. So in looking at this next, so, you know, what's different from being just down, or, you know, you just don't feel like your usual self? Well, a major depression lasts longer. It lasts more than 2 weeks. And people are finding that it interferes with how they concentrate at work. It interferes with their functioning for most of the day. And this feeling lasts. It's not just, oh, you know, I can shake this off. But it really is a sustained, uncomfortable feeling where you feel depressed. You just don't feel good about yourself. You don't feel good about what you have in life. It can feel like it's half empty, that you can't see the things that used to give you pleasure. For some people, you know, this change in energy that I put here, you know, a lot of people think that depression is, you know, when your system's just shut down, that you mope around and you don't feel like doing much. But actually, some people who get depressed can actually be more anxious. And I think, you know, some of the old classic visions of depression is, you know, this kind of hand-wringing, you know, that you're very worried and there's nothing that can make you feel less anxious. No support from your family or people who you relied on before can make you feel better. It just doesn't quite hit the mark. That you're very worried and you may be very anxious, and you continue to go over some things that you feel very guilty about doing. Maybe someone in your family says, you know, Mom or Dad, don't worry about that. I don't care about the fact that you know, you were late for 10 minutes when I was 12 years old waiting for you outside the gym at school. But the person is very concerned about this. Those are the kinds of things that make you wonder if somebody is very depressed, that they continue to ruminate, go over things in the past and go over and over and over, and you just can't shake it. Also, there can be a sleep disruption. For some people, what happens with depression is that you can lie awake in bed and go over and over and over these things that happen during the day, and you just can't let them go. So you may have difficulty falling asleep. The other issue is you can have a fitful sleep, that you may fall asleep, but then you wake up and you're tossing and you're turning, and it's difficult to feel refreshed the next morning. I don't think anybody expects that they're going to get a great night's sleep every night, but if this is persisting for several weeks, it can be a real problem. The other issue that I don't think gets mentioned much when you see these advertisements for antidepressants on the television is that one of the classic symptoms of major depression is early morning awakening. That you wake up at, let's say you go to bed at 10 o'clock at night, you wake up at 3:30, 4 o'clock in the morning, and you cannot go back to sleep. And you continue to think about this and that and worry and get very overwhelmed. Those are the kinds of things that make a doctor wonder if this is a depression and if you do need medication to treat that, so that you can get a good night's sleep and wake up feeling refreshed and at least able to get your job done or do the things that you've planned for yourself during the day. So if there's this persistent change in sleep, and I certainly have mentioned this change in thinking, where you continue to go over things that maybe happened 20 or 30 years ago and you're feeling guilty about it. Nobody else remembers what you're worried about, but you do. And you feel very badly about this, and there's nothing that anyone can say or do, and you're just convinced that you did somebody wrong or you did something wrong. They're going to come and get you. You're going to be in all kinds of trouble, and when somebody finds this out, you're going to lose it all. So this, and also having a change in being able to make a decision. That a lot of times when people are depressed, they go back and forth and back and forth, and they just cannot come to a conclusion. And if they come to a conclusion, maybe an hour later, they go, oh, change their mind. No, I can't do this. I can't. I just can't. No, I feel very badly about what I did. No, I think I've got to change this. So being confident in what you do, you know, there's a fine line between whether this is going to be a self-esteem issue, but the self-esteem issue is about being confident in your decisions. It's a little bit different than this very significant change in your mood. And also, a lot of people who are depressed have poor concentration. They just can't pay attention. You can't read that book. You may be a voracious reader, and then you find that, you know, I can't do this. I can't concentrate on this. I can't get through this. Here's a book. Here's my favorite book. I just can't. I can't look at it. I can't finish. And you get up and you walk around, come back to it. Can't finish it. Can't do it. And again, these are things that are a change. That this is not a lifelong issue where someone has, you know, attention deficit disorder and have true long-term concentration issues. You know, and I also want to say that for people who are older, you know, I'd say over 50, that sometimes depression can be confused with dementia, because, and there's actually a term, it's called pseudo-dementia, that people may have, be in the age range where you may expect dementia, but if they're very depressed, their memory may not be as sharp as usual. They're not concentrating like they used to. Their attention is not very good. They're not able to attend to their hygiene or take good care of themselves anymore. So again, you know, this can be a more rapid change compared to something that is occurring over a longer period of time. And I don't know if people have seen, you know, some of the advertisements on television for some of the antidepressants. I think one of them, and I don't really remember for what medication, but you know, the next point I'm making is that their body aches and pains. The advertisement for the depression is very good. It says, "Depression hurts." A lot of people find that they're much more super sensitive to pain and to body aches and pains when they're depressed. And they're much more aware of their body when they're depressed. And I think, you know, most people associate depression with a very down mood, but, you know, a lot of people get very irritable when they're depressed. That, you know, here's someone who may be very easygoing, that you know them for a long time, they've been very easygoing, and now they're really cranky. You know, they're much more super sensitive and much more irritable. So this kind of change in personality, you know, really needs to, you know, you need to put that in your awareness too, that, you know, this is not the way they usually do. Now they're crying at work and they're really cranky and short and snapping. Maybe they're depressed. And also, you know, people can feel more panicked and more helpless when they're depressed. You know, they just can't see a way out of how they're feeling. And also, this can go hand in hand with feeling more hopeless. You know, they don't think that there's much more to be offered in life for them. And this is when you need to be more attuned to either, if you're struggling with depression yourself or you have a loved one, that if people are thinking more about dying and death, and I don't mean making plans for you know, your will or things that you need to plan for in life, but this more acute process of feeling that they want to be dead, that there's nothing that is worthwhile living for, or they're thinking they should kill themselves. This is an emergency. And it does happen in depression. So that's, of course, while I would say, you know, you need to get treatment so that you can avoid some of these more serious consequences. So why should you get help? You know, obviously I just said that, you know, we want to make sure that we help people save their lives and save their loved ones' lives, because You know, you'll hear me say this again because it's treatable. This is not something that should be ignored, and it's something that you can get help with. That what I've told lots of people is, you know, what's important is talking with your primary care physician, you know, someone that you may have felt connected to for a number of years, because there are a number of medical illnesses that can look as if someone is depressed. So let's make sure that the medical illnesses are at least addressed and treated, because they can mask a lot of other treatable conditions. So I know I'm a psychiatrist, but I do want to make sure that people are healthy, because we want to make sure that if you do have chronic pain, that that's treated. Because actually, some of the medications that are used for pain can also be used to treat depression. I'm sure you've seen lots of advertisements for this on television too, but again, you know, you may get a medication that can treat both. Also, I notice that we have a number of women in the audience, and as women we need to be very aware of thyroid disease, because when women are hypothyroid, you can gain weight, you can have less energy, and actually if you have thyroid disease, getting that treated first is going to be crucial. What you may not know is that a lot of people who have thyroid disease, actually their antidepressants will not be as powerful if their thyroid disease goes untreated. So it can be complicated. And also, you know, Parkinson's disease. Some of the early symptoms of Parkinson's disease where people look very flat, have a very constricted mood, not a real wide range of emotions. Having their Parkinson's get treated, you may find that there may be an additional depression that can coincide with Parkinson's, but you want to get that medical issue addressed. You can always add on antidepressants if those are warranted, but you really have to get treated for some of these underlying medical conditions. Heart disease also, that, you know, if you have blocked coronary arteries, you're not going to have a lot of energy. You may feel more fatigued or have some body aches and pains. Get this treated. There are plenty of medications that are heart healthy, or at least safer. I don't know that a lot of people know that actually diabetes, a lot of people who have untreated diabetes, you know, they don't have the energy that they used to. It can affect your sleep patterns. You know, so get checked for this, that you want to make sure that that's adequately treated. Because, you know, I usually work with a lot of patients who are in the hospital, and we're, you know, very aggressive about making sure that some of these medical illnesses are treated first, that you get your blood sugars well regulated, you can sleep better. And if that's happening, then you may get by with less medication for depression. And also, you know, for people who have cancer or have been diagnosed with cancer, you know, pancreatic cancer is a perfect example of people who may be very depressed, and that needs to be treated. You know, one of the consequences of pancreatic cancer is depression, and we may be able to help with other ways to address the mood that goes with that. Also, reviewing with your doctor the medications that you're taking. You know, it's not unusual that some people are very sensitive to side effects of their medications and in fact may become depressed as a result. You know, some of the older antihypertensive medications, may be familiar with propranolol, that had been used for hypertension. A lot of people became depressed. It was more lipid soluble than some of the newer medications, and we found that if you used a different antihypertensive, some of the depressive symptoms resolved. There's some other older antihypertensive medications that people very frequently got depressed on. So you want to look at that long list of side effects that accompany almost any medication that can be prescribed. And also, I think, you know, the next point we're coming to is alcohol. If you've noticed that maybe one of your friends or someone that you love is drinking more frequently, alcohol is a central nervous system depressant. And we very frequently advise any of our patients who are recovering from depression to not drink until their depressive symptoms have resolved. It really can worsen your mood. It can certainly interact with some of the medications that you take, but alcohol alone can be confused with depression. And I think you want to make things more simple and less complicated. And for some people, stopping the alcohol may improve their mood. And you know, you may not know that alcohol can really interfere with people's sleep pattern. That the way alcohol gets metabolized, a lot of people wake up in the middle of the night. They think they have a sleep disorder, but actually it's the effect of alcohol on how deep you sleep. I did put in here drug addiction because I think in some of the younger populations or people who are on pain medication, some of the opiates, narcotics that people are using for chronic pain, some of the chronic pain medications like Oxycontin, Percodan, Percocet, some of the older anti-anxiety medications, some of you may remember meprobamate, Valium. Some of these are central nervous system depressants, and they may worsen depression. So it may require you talking with your doctor about maybe there are some medications that can be used for pain that won't have the depression as a consequence. So making sure that people are not overusing prescribed medication or alcohol can contribute to an improvement in mood. Some of the other reasons why people need to get treatment for depression is we do want to help people save their lives and prevent suicide. Approximately 15% of people with a severe major depression may commit suicide. You know, again, you know, we're coming into the holidays, and I think people need to be aware of friends or family who may be more vulnerable to this. You may want to make sure that you get help. And those that you need to be aware of is if someone has made a suicide attempt in the past, that they are more vulnerable to a subsequent suicide attempt. Also, if there's a family history of suicide, they may be more vulnerable to this as well. And if they're actively drinking to excess or abusing some of the prescribed medications for pain, that may worsen their judgment, and they may be more likely to act on some of these thoughts than if they were not drinking or if they weren't on medications that are depressing their mood. Also, I think a lot of people who struggle with lifelong medical complications or medical illnesses, you know, if you're struggling struggling with diabetes, maybe insulin-dependent diabetes where there's been loss of limb or loss of function as a result of heart disease, or that has incapacitated you or prevented you from doing some of the things that you previously enjoyed doing. That's an important talk to have with your doctor or with your family to seek out options for our help. Also, men who are living alone, we need to be very careful about, I know everybody here has to have had a father, and you need to be aware that they may be more vulnerable if they're living alone, or if you have a brother or a son. This is something that you need to be aware of, because, women characteristically talk more. We have more relationships. That's what the research is, that we're more involved socially. So I think you have to be aware of what's happening with the men in our community, and making sure that they have options and things to hope for. So what helps? Here we've gone through, well, what is it? What's depression? What can we do? First of all, please make sure that if there's some medical illnesses, that those get addressed and get treated, because that really can make a difference in how you respond to any medication that's used for depression. And actually, I'm a psychiatrist, I can prescribe medication, but honestly, people who have a mild to moderate depression may not need medication. So it's not like if you feel depressed that the medication is going to be the answer. But for a lot of people, it can be very helpful. And if you have a depression and counseling alone has not helped, that for moderate to more severe depression, the research has been that therapy, talking with a doctor or with a therapist, a counselor, a social worker, we've got lots of mental health professionals who are very aware of how people who are struggling with depression, that a combination of medication and therapy has been the most successful. And for moderate to severe depression, antidepressants have been very helpful. About 60% to 3/4 of the people can respond to an antidepressant, and people recover from depression with those medications. But more severe depression, one where I described the melancholia, this kind of very, very dark mood that does not change with some of the medications that have been used, or with therapy, or with more family work or other avenues of support. And if the person is thinking about death and dying and is not getting better, they may need to come in the hospital. And then I'll mention that if medication doesn't work and someone is feeling very, very desperate, ECT or electroconvulsive shock therapy may be helpful. And I'll go over that, because I know people may hear that and be very concerned. But the most common antidepressants that are used today are serotonin reuptake inhibitors. Very fancy name for a lot of medications that you may be familiar with. That Lexapro, Celexa, Zoloft, Prozac, that group of antidepressants for a lot of people are very well tolerated. A lot of people have very few side effects to them. But some people are very sensitive to it, so you do have to be aware of that. But there's some older antidepressants that had a number of side effects, like cardiac side effects, and these have been safer. The SSRIs have been around for a number of years that have been helpful and well tolerated. They're not for everybody, but a lot of people do well with those. Also, I think, you know, some of the more painful experience that people may have with muscle aches and pains, Effexor and Cymbalta. They're a different type of antidepressant for people who may have more of an anxious depression. The Cymbalta and Effexor have been very helpful. Some of the newer ones that are not in an easily pigeonholed grouping are Vibrid, that is newer. Wellbutrin, a lot of people may know it as a medication to help you stop smoking and to give you a lot of energy. Some people can tolerate that, and that can work very well. Another antidepressant, Remeron, honestly, that's been used more frequently in older adults. A lot of times for people who are over 50, they do well with Remeron because, you know, some people who are very depressed don't have much of an appetite, can't sleep well at night, and feel very anxious, and Remeron can help with that. But what's important to know is that you may have a number of different episodes throughout your lifespan, and a different medication. It may be that Lexapro may work at one depressive episode, but maybe it doesn't work at another depressive episode, and you may switch to something like Wellbutrin. What I want to convey is that if someone has had a number of different depressive episodes, that you don't give up, that there are a number of different options and choices that can be helpful. And also there are other additions. So I want to give you the idea that there really is hope in treating depression, that you may have also seen some of the advertisements about Abilify, that added to an antidepressant may help. Some people do well with the addition of lithium. Some people do well with Depakote alone as an antidepressant. Some of the atypical antipsychotics, you know, Abilify is one of them. That added to an antidepressant. There are a number of people who do well with that. So again, what I want to tell you is that there are a number of different options and avenues, and that treatment for depression can be frustrating at times if people don't get, you know, a positive response immediately, but don't give up. There are other choices. I do want to mention ECT, because I think that ECT has gotten a lot of bad press, that it had been done in a particular way maybe 30 years ago, but there have been advances in the use of ECT. The reason I want to mention it is that it works faster than antidepressants. It can be very effective. It can be used in people who also have heart disease. It can be supervised very differently now than in the past. That in the past, I'm sure people have seen One Flew Over the Cuckoo's Nest. You know, at that time, anesthesia was not used. It's really considered to be a medical procedure that it has advanced to the degree that you just get a very short electrical impulse. We don't know why it works, but for a lot of people it really is very effective and can cut down on recovery time. That it is very safe, it is effective, you have a very brief seizure, people recover. Some people will go on to have maintenance ECT as an outpatient. So I just want to make sure that you know that it's an option, and I know it can sound very scary, but I have seen a number of people who have gone marching through a number of different antidepressants for many years. They have ECT and they feel much better. So I don't want people to forget that. And in the past, ECT had been done bilaterally. Usually we do it unilaterally now, so there's much less of a memory loss. And some people don't have any memory loss when they have ECT. So I just want to make sure that, that I at least educate you a little bit about that option. But if you don't get treated for depression, you can really suffer and experience from sleep disruption, anxiety. It can take about a month and a half to get maximum benefit from an antidepressant, and you have to be able to get to the therapeutic dose. So I know that that can really take some time for people. So if you or a family member or a friend is saying, you know, this is taking so long, unfortunately, this is part of it. That's why you want people to be in therapy also, so that while this is starting to take effect, you're getting some support and learning some other skills that as you improve and antidepressants are being tapered off, your mood continues to improve. And I think I mentioned earlier that each depressive episode can be different, and a different intervention may be helpful at that time. And to please be patient, that it may take time to recover from a depressive episode, and that you or your family member at least give medication an adequate trial, or therapy an adequate trial, or the combination of both. Also, there are some very basic things that people can do to improve their chances of recovering from depression. And that is things like sleep hygiene. You may have heard of this. What this means is really that you get back into a routine, that you need to be going to bed at the same time every night, trying to get up in the morning about the same time, that your bed is used for sleep, that you're not eating in bed, that you're not looking at electronics late at night, that all of those devices get shut off about an hour before you go to bed. I'm recommending this to people who are trying to recover from major depression. This isn't necessarily what everybody's going to be doing, because if you can sleep through the night, then it's not a problem. But for people who are really struggling, these are the kinds of things that can help. And also adding in exercise. You know, I know you hear from doctors, you know, you need to eat right and you need to exercise. I'm talking about very moderate exercise. And if you go for a walk for about a half an hour, 5 times a week, those are the kinds of things that help, because it stimulates your endogenous endorphins. Gets those endorphins going, and you're going to, most people feel better. And actually there have been some research studies on continuing to exercise can decrease your risk of relapsing into depression again. And of course making sure that you're eating healthy, and that you start with small steps. When people are recovering from depression, it can be very easy to get very overwhelmed. And expecting that someone who's been in the hospital, started on antidepressants, you can't expect them to be cooking the holiday meal, that they may need extra help. And you can't expect yourself or someone who's recovering to give the big holiday party. Start with small things so that you don't feel defeated easily. Also get some sunlight. I didn't mention seasonal affective disorder, but that's another form of depression when people are very sensitive to this change in sunlight. I think a lot of people are very sensitive to that in the wintertime and around the holidays, and just not have the usual energy. So if you can get out, get a little bit of light, or, you know, even some of the stores sell some of those bright lights that you can use in the morning to get you going. Also, making sure that in therapy you identify the kinds of things that you can control in your life, rather than feeling overwhelmed by everything that comes your way. Also, I think it's very therapeutic for people to learn how to relax and feel more at home with themselves and less critical. So that is something that if you're recovering from depression yourself, that you need to be mindful of. So how do you recover? Well, I think it's very important for people to know that actually your friends and family may be more aware if someone is starting to recover than the person who has depression. People who are in the middle of depression may not see that they're doing better. And I think family and friends can be very helpful in making sure that people are taking their medication regularly if that's been prescribed. Because antidepressants don't work like pain medication. You know, Tylenol or Motrin lasts for about 4 hours, but antidepressants need to be taken every day, and it's not something you take when you feel depressed. You need to take it every day. Also, you need to develop an emergency plan if someone's mood gets worse. Also, it's important to know that it really can take time to recover from depression, that it may be a year, year and a half. So don't get discouraged. This really is the timeline. For some people, it may be longer, and that as you improve, your antidepressants may be decreased over time slowly, so you make sure that those depressive symptoms don't come back. The other issue is making sure that you don't stop your medication abruptly without talking with your doctor about it. And that if you have stopped, that you let them know. I mean, obviously, if there is some serious side effect, you know, you have nausea and vomiting, you stop and you call. But it's important to let your doctor know that, you know, this isn't working out for you. Rather than telling them, yes, I'm taking it, and they're increasing the dose without knowing that you've said, you know what, this isn't working for me. So how do you prevent relapse with depression? Take your medication as prescribed, and that's something that you and your therapist or your doctor need to discuss. Is that what you want to do? And, you know, I mentioned tapering this slowly. About half the people who have had one depressive episode may be vulnerable to developing another one. So it's not unusual. And if there have been several episodes of depression and you're later in life, antidepressants are not addictive. It may be that some people need to take them for many years, but it doesn't mean that you're addicted to them. What it does mean is that it may work with your particular biochemistry and help you feel that you have the energy to take life on and to enjoy your life. So, what I'll remind you is that depression is very treatable, that people recover all the time, that if you don't get treatment, there can be a significant loss of life and people who you care about. And there are many options for treatment. There's not just one way to recover. So, I wondered if anybody had any questions. Certainly.